Hey everyone, my name's Taylor. Some of you might know me a little bit better as Wobble. I was a Holly Lake 4-H Educational Center staff member from 2013 to 2016, and ever since I left the 4-H Center from the summer staff, I've been working for Delta Response Team, which is a private EMS company. They provide a lot of staffing for the 911 agencies and a lot of counties that actually attend 4-H camp. So since this summer is going to be a little bit different, we're not actually able to go to camp and enjoy ourselves and see everyone in person. They thought it'd be good for me to maybe give you a little tour of the station I'm currently working at and see how things run for our virtual first responder camp week. So I hope you're having a great summer so far. I'm glad that you're sitting here watching this, and I hope you're enjoying this as well as all the rest of the wonderful programs that they've got lined up for you this summer. And here we go. All right, y'all. We're gonna take a look in the back of the truck. Welcome to the back of the truck. You might see a couple things in here that are familiar to you. We have a stretcher. It's where people will sit or lay if they are going to the hospital. Lots of safety belts there for them to get strapped in. We got a monitor here. This is what we use to, it does a bunch of cool things, like you can check your blood pressure, check your pulse oximetry reading, or it can even get a look and get kind of a picture of your heart and let us know how your heart's beating and if there's anything going on with that. So that's pretty cool. We have a seat. Look at that seat. That is a nice seat there. Oh, look at that. Look at that seat. That's an even better seat. Look at all these safety belts. Gotta make sure you stay safe. Always wear your seatbelt. Don't want to be bouncing around while you're riding on the road to the hospital. It'd be awkward. You might be able to see a bunch of cabinets that we have in here. They're a little bit streaky there just because we, every time we have a patient, we have to clean it out afterwards, and we use a spray so it kind of leaves a little marks there like that that'll have to be cleaned up. But it's all cleaned after every call, so we want to make sure we get rid of as many germs as we can. But in that cabinet, that is our airway compartment. So that has everything from like your nasal cannulas or masks to help assist people that maybe aren't breathing so well, to different kind of bags to maybe help breathe for the patients, things like that. So that's lots of cool, very important stuff in here. In this compartment, this is our first aid compartment, basically our trauma compartment. So if anybody gets injured and maybe they're bleeding or something, this is where we would go to get whatever we need to fix that. So this has everything from your gauze and your big trauma dressings to your band-aids and your little hot packs, cold packs, triangular bandages, you know, things like that. That's all very cool. More trauma stuff. Let's see here. This is, oh, how cool is this? We have blankets. We got sheets. In case you get a little chilly on the way to the hospital, the AC is kind of finicky sometimes. Sometimes it works really well, but you aren't able to fix it, and it's like freezing and kind of makes everyone uncomfortable. So you have plenty of blankets. All right. So, like I said before, this is our monitor, and this is where we do most of our monitoring for our patients while we're actually going to the hospital. So I'll just turn it on there, and this does a lot of cool things. So, like I said before, it checks the blood pressure, it checks your pulse oximetry, which is like the oxygen reading in your blood. And you just put a little probe on your finger, like so. Yeah, put it on like that. And in theory, that should start to come up right there. It's going to make a liar out of me. Oh. There we go. Oh, I'm alive, y'all. Look at that. It's beautiful. Look at that breathing. That's some good breathing there. Okay, enough of that. So it does that. It's got all these cables in here, and these, I won't be able to hook it up on myself, but basically you would put those on your chest or on the patient's chest. That'd be kind of weird if you went and pick up a patient and put them on your own chest, whatever. But you put them on the chest, and based on where you place them, it gives you a different view of their heart. So I don't know how much you do or do not know about the heart, but your heart has its own electrical system, and so basically these cables pick up on that, and so that tells you if it's your heart's beating properly or something's maybe not working like it's supposed to. And that helps give us an idea of what we need to do to treat our patients. So that's kind of cool. Over here we have a different cable, and this actually hooks up to our AED pads. Here, which are these. And so a lot of public places have devices that are similar to this, not quite as fancy, but they do basically the same thing. But what these do is if somebody is in need of CPR, so if their heart has just quit working altogether, you would start compressions, chest compressions, which is taught at any CPR class. So if you don't have your CPR certification or haven't been taught in CPR, first aid, anything like that, I would highly recommend you do it if it's available to you. It's definitely worth the time and effort. You never know when you might need it. Hopefully you never do. Don't want to do it, but you never know. It's better to be prepared. Anyway, basically these cables, you pull them out if you needed them and hook them to this. And if the patient's heart is in a certain rhythm, we are actually able to defibrillate it. And that's basically just giving the heart a shock. And so we would use the monitor to deliver a shock and hopefully get their heart working like it's supposed to. And here we are. We've come a long way in this tour. We've gone all the way from the back of the truck to the front of the truck. I hope you've enjoyed it so far. But yeah, this is the front of the truck. And at our station, we drive Fords. So if anyone in your family or if you know anybody that has a Ford pickup truck, this is essentially the same kind of truck. The only difference is, of course, it has the big box on the back where we actually do our patient care. So that's where we call it the patient compartment. And it also has this little funky little center console here. And so let me move the hand sanitizer. Make sure you keep your hands clean. Lots of hand hygiene here, folks. But yeah, this is the center console, and basically this controls all the different lights and things that we have on the outside of the truck or in the patient care compartment. So we have our emergency master switch, and if you flip that up when the whole box is turned on, then if these two lights are up like they are, that will turn on all the emergency lights. So like if we're responding to a call, those flashing lights you see, that would be these buttons here. So that's pretty cool. And we have our master to the back, so any electricity going to the back won't come on unless this button's flipped. So that's pretty important. This is fun. This is where all the wee woos come from. So if you hear us coming down the road and you hear the wee woo, yeah, that's this thing right here. And basically the trick is to turn this knob to a siren that you like, and then you just make a lot of noise. It pretty much does itself. It's not too much to it. I might honk the horn a few times, that's it. But basically, when we're responding to a emergency, we want to make sure everyone, not just our patients, not just us, but everyone in the community is safe. So we use our lights and our sirens here to let everyone know that we're coming down the road, and to hopefully give everyone enough time so that way they can yield over on the side of the road and give us space to pass by safely. We definitely don't want anyone getting hurt when we're going anywhere, so that's why we have those on our trucks. So it's pretty important that we have those and make sure that they're functioning properly every day when we come into work. Alright, so just a little bit about our station on the inside. This is our kitchen here. We have one because we actually work 24-hour shifts, so I clock in at 7 a.m. and clock back out at 7 a.m. the next day. We respond to anything that happens in between those times. And here, we haven't had a chance to make my bed yet, but this is one of our bunk rooms. We have two rooms. We have two providers that stay here overnight, so usually each of us gets our own room. But this is where we make ourselves comfortable. We have radios that we'll bring in here, and if we get a call overnight, we'll have them turned up so that way we can actually hear it and we know where we're going and we can get there. We have our TV in here. I've got all my little drinks and stuff here on the table, but this is where we usually hang out during the day. And yeah, that's pretty much it for our station. We have a tiny station, but it's nice. The county takes good care of us, so we're very fortunate to have what we have. All right, so that's pretty much everything we have at this station. We don't have a huge station here, but we definitely have enough to do what we need to do and to serve our community, and that's what's most important. I'm very fortunate to be able to do what I do every day. I love what I do. Very glad that I've chosen the career that I have, and I hope you enjoyed just getting this little look at what it is that I've been doing since I left 4-H for my seasonal position anyways. I hope you enjoy the rest of your first responder week and the rest of your virtual 4-H summer camp. I hope you have a great time. Stay happy, stay healthy, continue to make the best better, and 4-H.